My name is Neil Baum. I'm a urologist in New Orleans, Louisiana, and I'd like to take a few moments to talk with you about intermittent catheterization in women. In this 5-minute video, I'm going to describe intermittent catheterization, show you how it is done, and explain the risks and complications of the procedure. Intermittent catheterization is the temporary placement of a catheter or tube in the bladder to allow the bladder to empty the urine inside the bladder. The purpose of intermittent catheterization is to completely empty the bladder in order to prevent infections or damage to the kidneys. So let's look at who are the candidates for intermittent catheterization. Any woman who is unable to properly empty the bladder could do intermittent catheterization. Women who have certain neurologic conditions such as multiple sclerosis or who have had a problem of diabetes with injury to the nerves to the bladder would be candidates for intermittent catheterization. And also, intermittent catheterization is common to use in women who have had previous gynecologic surgeries and have a temporary difficulty emptying the bladder, and intermittent catheterization is used until healing occurs and the woman is able to empty the bladder on her own. So how is intermittent catheterization performed? Most people can perform intermittent catheterization with a brief instruction and just a little practice. Usually it is done by self-catheterization, and it's usually done 3 to 4 times a day, depending on the volume of fluid that the woman consumes. You will need some equipment. You will need a catheter. You will need soap and water and a moist towelette. You will need a lubricant unless the catheter is already pre-lubricated. You will need to be near a toilet or a receptacle that will accept the fluid or the urine. You should wash your hands with soap and water, and then you will need to take the vaginal opening and clean it with a towelette. And then you will take the catheter. This one is a low-fric catheter. You will take, which is pre-lubricated. You will take the catheter and then spread the lips of the vagina and then insert through the urethra, the opening at the top, the catheter slowly until urine or fluid comes out of the catheter. You allow the bladder to completely empty its contents, and then you will slowly remove the catheter after the bladder has completely drained. You then take the catheter afterwards and you can wash it with soap and water and use it again. If the catheter is disposable like this one, then you can discard it. If it is reusable, rinse the catheter completely, dry it until the next time it is inserted. You will want to store the catheter in a clean, dry, secure location. Most women find it easily accomplished by using a Ziploc bag. There are some important things for you to remember if you are doing intermittent catheterization. Most women will find that they can do it standing up by just placing a foot on one side of the toilet and then finding the opening and inserting the catheter into the opening. You may use a catheter usually for several weeks. If you're going to reuse the catheter, I recommend that you soak it in white vinegar solution approximately once a week to remove any debris or any odor that may accumulate with the catheter. You want to try to empty your bladder as completely as possible and do it regularly. You want to try to avoid not having a volume greater than 400 cc's, which is about equivalent to the volume in 2 cups. So you want to keep the volume of urine down, and the more fluid you are taking and the more urine that is in the bladder, you may have to increase your level of catheterizations from 3 to 4 times a day. There are various risks and complications associated with intermittent catheterization. The most common are urinary tract infection. Occasionally the urethra or the bladder can become irritated, and there might be a small amount of bleeding that occurs after the catheterization. And only rarely in women will there be a complete failure to insert the catheter to empty the bladder. So in summary, intermittent catheterization may be necessary to prevent infections of the urinary tract and to prevent kidney damage. I hope I've shown you that intermittent catheterization is easy to do. And intermittent catheterization is good for your bladder and your kidneys. I hope you have found this video helpful and informative. If you have any additional questions, please don't hesitate to go to my website, www.neilbaum.com, or you're welcome to call me at my office, 504-891-8454. Thank you.